Exactly. Two wonderful guests today. Journalist first, Sam Cooper. You can follow him on X at @SCooperCooper, Cooper, Scooper Cooper on X. The Bureau.news is where you can find his website. And Sam is an investigative journalist and founder of The Bureau. Best-selling book is Willful, Blindness, where he has exposed the election interference, amongst other things. And he has been digging deep into the fentanyl distribution in this country, led by none other than our friends at the CCP, laundering money through casinos in British Columbia. So he's going to tell us about that. For anyone that spends any time on the streets with the homeless, it's not subtle what's happening, it's obvious. Then Elex Michaelson comes back again this week to give us a report on what happened in the LA riots and with the curfew. Elex is at Fox LA and at Elex, ELEX_Michaelson on X. Right back after this with Sam Cooper.
Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want to help stop it, I can help. I got a lot to say. I got a lot more to say.
I'm excited to bring you a new product, a new supplement, Fatty. I take it. I make Susan take it. My whole family takes it. This comes out of, believe it or not, dolphin research. The Navy maintains a fleet of dolphins, and a brilliant veterinarian recognized that these dolphins sometimes developed a syndrome identical to our Alzheimer's disease. Those dolphins were deficient in a particular fatty acid. She replaced the fatty acid, and they didn't get the Alzheimer's. Humans have the same issue, and we are more deficient in this particular fatty acid than ever before. And a simple replacement of this fatty acid called C15 will help us prevent these syndromes. It's published in a recent journal called Metabolites. It's a new nutritional C15, pentadecanoic acid it's called. The deficiency that we are developing for C15 creates something called the cellular fragility syndrome. This is the first nutritional deficiency syndrome to be discovered in 75 years and may be affecting us in many ways, and as many as 1 in 3 of us. This is an important breakthrough. Take advantage of it. Go to fatty15.com/Dr. Drew to receive 15% off a 90-day starter kit subscription, or use code Dr. Drew at checkout for that 15% off, or just go to our website, drdrew.com/fatty15. And if you want to complete your longevity program, I take Fatty 15. My whole family takes Fatty 15, as I say in that. But I've also developed Cenosanc, which is resveratrol and fisetin, and NR Boost, which is nicotinamide riboside and PQQ. These are my 3 go-to every day for longevity. And I'm actually really excited about this stuff because it does make a difference. It's withstand scientific scrutiny. vshredmd.com is where you can get those products, and I suggest you start them early and just stay with it. All right, let's get to Sam Cooper again. The book is Willful. Let me get, whoops, I got to get it right here. Put the book up there, Willful Blindness. There it is. It's all about what is going on the streets in our country and how pathetic our government has been in response to it. You can follow Sam at Scooper Cooper on X and thebureau.news, where he was a founding journalist. Sam, thank you for being here.
Really glad to join you, Dr. Drew.
So tell us what you have uncovered about fentanyl and British Columbia and why no one in our country is doing anything about it.
Well, I grew up as a young reporter in Vancouver, and I know these scenes are common now in cities like San Francisco, where you would see people literally overdosing on the street, people just walking by. And so as a young reporter around 2010, 2011, I was studying why Vancouver's real estate was astronomically expensive, why there seemed to be luxury cars everywhere you looked at the street. And yet the city, you know, the honest workers weren't that rich. And so I connected what I saw as that drug overdose crisis. It was heroin in the early 2000s. And in 2011, we saw our first known case of fentanyl. By 2013, those those death totals just start going exponential. So at the end of the day, I discovered that the Chinese Communist Party, working with transnational organized crime called triads, and eventually the Sinaloa cartel, the Jalisco New Generation, all the bad Mexican cartels had set up, especially in Vancouver, British Columbia, essentially because the worst of organized crime, the worst of terror sponsors have infiltrated Vancouver's port. And so that's why the fentanyl, those precursors, essentially from China, from the Chinese factories, are pouring into Vancouver. We have super labs being set up in Vancouver. And this is where the worst organized crime in the world is dealing, that illicit fentanyl across the country after, as you know, Drew, the sort of opioid addiction to pharmaceutical opioids started earlier in places like West Virginia, but now organized crime sponsored by China has taken over, and they're using Canada easily. That gets to your question, why our governments are so they're handling this badly. Look, American law enforcement is pretty tough. Still, America, I would say, is being attacked by cartels. They're being attacked by China, intentionally with fentanyl. It's hard to deal with. But Canada and Mexico are being used easily by these transnational crime networks.
Well, I still don't get how it works in the sense that I understand that, first of all, drug addicts are being used by somebody, whether it's the distributors of fentanyl or the creators of the illicit market or the government of both of our countries. I ran a drug treatment center for 20 years. These are my patients. I knew it immediately when they started preventing, in particularly in California, you're not allowed to treat drug addiction anymore. You're not allowed to. You're kidnapping somebody if you ask a drug addict to do anything. And if you don't ask a drug addict to do something, that disease will progress and that person will die, period, end of story. And I don't care where they're getting the drugs from. I don't care if the Canadian government sends a nurse out to the street to inject them 3 times a day. It still progresses and they still die in all situations, no matter the circumstance. That's how it works. So what is going on with, how did California and British Columbia get so closely aligned in terms of this misguided and frankly, it's manslaughter at best. It's negligent manslaughter. How did they end up in the same place?
Well, I appreciate that you're bringing it up from the medical and the health policy response perspective. I've attacked this, if you will, or investigated it from the law enforcement and, criminal interdiction perspective. And so my perspective in Canada is that our law enforcement, our border enforcement is so weak that the Chinese triads working with Beijing, that is the Communist Party, have chosen Canada, especially Vancouver, as we could call it a beachhead or an attack node. In fact, I've got U.S. government sources that do call British Columbia a beachhead for the Chinese Communist Party and now the Mexican cartels. So that's law enforcement. Now let's jump over to health response. Look, harm reduction is a good philosophy. We should be trying, if we can, through medical prevention to get people off the most toxic, opioids coming from criminals. But it becomes very misguided when a government, and they slant, of course, left-leaning or ultra-liberal in these policies that they say, okay, let's replace, quote-unquote, toxic fentanyl with opioids coming from pharmacies, and this will keep those addicts alive. But the problem, Drew, as you know, is these programs are being administered by people, frankly, in university classrooms that have
Caleb, I don't know if
crime
froze. Oh, there we are. You're back. So you froze for a second there. I don't know if that was
so
that's one way of framing it, but it's even worse. So here's my position. The word harm avoidance has been captured and misused. It is a medical intervention. Harm avoidance, a medical intervention administered by physicians in the context of a treatment plan. Not something that's randomly given by social workers on the street or students in university settings, as you've said. And it also, it's not that does not include just giving the patient their opioid of choice at the dose they wish, at the interval they wish. That is not harm avoidance. That is progressing a deadly illness, period. There are harm avoidance strategies that are part of a treatment plan that can be instituted by physicians, but first of all, it's all being done by social workers. And as much as I love my social work colleagues, they are not trained. They have no experience with, you cannot be sicker than these people on the street. That is as advanced as opiate addiction gets and any other form of addiction other than death. It's the condition just before death. It's the lowest functioning, the most extremely ill that would require a team of very well-trained professionals in a structured environment for an extended period of time if we're going to save that person's life. Giving them an opiate and a syringe it's murder. It's not even manslaughter, it's murder. Now, they may not understand they're murdering that individual, and maybe it's manslaughter then, technically, whatever, but we need to raise awareness about what they're doing. They're murdering people. But I don't, who are they listening to? Where do they get those ideas from? What is the end game here? Do they not see what's happening? Are they claiming success? You know, it's interesting. I was talking to a young lady, a social worker, who was working in the housing placement thing, and she had a very successful housing program and had lots of wonderful environments. And she goes, we put them in these great environments, and it turns out we're not done once we get them in the units. I'm like, of course you're not. These are, if they were staying in their bedroom at home, we would still have to put them in a psychiatric hospital for 3 months. It's just insane. Who is doing this? And is it all government paying people off? Is it that they infiltrate these do-gooders with these criminal organizations and are paying off people within these do-gooder organizations with incredible sums of money that keep them going in the wrong direction?
Well, Drew, as you know, the original story of these American pharmaceutical companies involved people that became addicts because they had workplace injuries. And so they start to go doctor shopping and they start to get, fraudulent prescriptions. So obviously there's corruption right from the start.
They did not get fraudulent. People miss what happened with the opiate. I lived through that thing. I was fighting it tooth and nail. The way it got started was in North Carolina and Florida and California, a group of wise attorneys realized they could go around physician malpractice and accuse doctors of criminal and civil actions of patient abuse if they did not give the patients enough pain medicine. And these cases were multi-million-dollar cases. There were doctors put in prison because they didn't provide enough pain medicine. This was in the late 90s. We all froze in place. We all were afraid to prescribe and to deal with a pain patient at all at that point. We sent everybody to pain management. Pain management, I have all these quotes from the pain management doctors of the time where they felt like they were the salvation for the United States that any individual should ever feel pain ever again. We have a solution. It's always been there. It's in the poppy plant. And no one in America will ever feel pain again. Pain is what the patient says it is. Pain control is what the patient says it is. And then, of course, organizations like the Sackler family breathed wind into those sails. But the real criminals were the insurance companies, the regulatory agencies, the professional societies, the state medical societies that mandated, and the VA mandated, pain is the fifth vital sign. Where do you think that came from? That came from the regulators. The pain, and literally, if you did not put someone's pain scale on their ER visit, that was more of an egregious violation than not putting their pulse. It was insane. And this went on for 20 years. Until I was at a symposium at the White House, and Jeff Sessions, of all people, came in and said, I see what this is. I know what's happening here. I'm going to tell you something. I'm going to take care of this in 3 months. And he put a half a dozen or a dozen physicians in prison for overprescribing. And overnight, doctors again froze and stopped prescribing opiates. And now you can't get opiates for your patients. Now it's impossible to get them even for a patient that needs it. In the meantime, all these physicians who don't understand addiction threw up their hands and went, oh my God, these are bad patients. They're drug addicts. And they would not return their phone calls. They sent them away from their practices, as opposed to calling them in and saying, look, I didn't realize this was happening. We've caused a new problem. It's addiction. I didn't understand it. Let's get you care. No, they sent them away. And where did they went? Where did they go? Of course, they go to the street, and then they find the heroin. And that's what gave us the heroin epidemic. And then the cartels and everybody took advantage of that by pumping in fentanyl. And they've expanded that further by putting fentanyl in Xanax and cocaine and everything else. So that is the story medically of how we got here.
That's the situation. And if you're saying legal malpractice and corporate malpractice is where this starts, you'll get agreement from me. I would also point to government policy, and we could just say ivory tower academics. And really, they're not pure as the driven snow, because some of these academics, I do believe, are getting paid in the back door to put forward these public health programs. But Drew, I'll give you a few crazy data points. You're shaking your head, but look, it's right that the people now administering these opioids through public health clinics in cities like Vancouver and Toronto
I got to say, though, I cringe. I got to tell you, hang on, just the fact that it's public health again. We have such a huge problem with public health. It's effing crazy. Public health brought us the catastrophic aspects of COVID. Public health there's something terribly wrong with the whole public health system and philosophy. There's something terribly wrong there. But go ahead, administer through public health.
Let me give you the data point here.
Makes me cringe. Yep.
In the city of Toronto, just about a year ago, a young mother was shot outside an opioid harm reduction clinic. A user, a young man, was allowed to escape because one of the healthcare workers inside facilitated his escape so that the police could not apprehend him. And just the other day, it became clear that this quote unquote healthcare worker or social worker will not see a day in jail. So a young mother is dead outside one of these clinics. And look, the people that want these programs are saying, no, we don't want any doctors there. Let us just continue to hand out. But look, when I've looked at the issue of you increase the supply of opioids, more people will die. The problem will spread to younger people, because now we have 10, 11, 12-year-old girls can buy a dilly on the street for $2, $3, right? And it used to only be passed out through doctors. That's the situation we see in Canada, and I believe in some American cities as well.
Is anyone in the Canadian government, or at least in the regional government in British Columbia, interested? Because California, families go up there and beg them for at least the laws to loosen so they can help their loved ones. They have money, they have resources, they have doctors, they have hospital beds, they have a room for the patient. They're told to take a hike. What happens in British Columbia?
Well, this really gets to the heart of it. In Alberta, which leans a little bit more conservative, they have policies where they sort of insist that, okay, if you're going to seek treatment, it may be that we try to get you off opioids. In British Columbia, the approach has been, no, we're going to give out government opioids. So that has led to organized crime coming in. And as you know, it's called diversion. They will buy these pills, they'll ship them across the country, ship them around the world. The cartels likely are using these quantities to simply increase the supply. British Columbia's government was gaslighting, saying nothing to see here. Our program is fine. Meanwhile, the streets are getting worse. Now, there was a report leaked by a opposition politician named Eleanor Sturko showing that there was deep corruption in British Columbia's opioid supply program. This was repeatedly denied by the government, but the report was leaked. And so very slowly, British Columbia's NDP government, and let me make a connection, you realize that Kash Patel pointed specifically to British Columbia, saying the CCP, the triads, the Mexican cartels, even the Russians and the Iranians are using British Columbia for fentanyl. Look, British Columbia's NDP government said nothing to see here. They still say nothing to see here. And I don't think it's very coincidental that they're pushing this free government opioid program. And let me stress, everyone wants to save lives. But if you're not monitoring that program and you're letting organized crime take the supply, dump it into their fentanyl quantities, something's very wrong. And it does make me question, is there a deeper corruption issue there?
Not only that, do they have any evidence that this is working? I mean, the evidence is so obvious that it's a catastrophe, a human catastrophe. How are they going to, how can you possibly claim victory? I mean, it's so insane.
No, there's a lot of doctors. I recently published a report on the Bureau from a Canadian think tank, from an addiction specialist doctor, saying, look, this is purely ideological. Only Canada is pushing out free opioids to people and thinking that will reduce opioid deaths to the level that we see in Canada. And there's really no well-reported evidence-based doctor studies showing that lives are being saved. In fact, it looks like it's getting worse.
Of course, it's getting worse. You know, we brought the California brought the mayor of Amsterdam. Amsterdam used to be just like British Columbia. They had the worst opioid problem in the world, and they had these shooting gallery parks and things, and they allowed people to use there. This mayor came in, cleaned the whole thing up, got everybody treatment, and it's now one of the greatest cities in the world, and has no problem with any of this. And he came to California, how did you do this? Well, let me tell you how. And he was also told, get out of here. Get out of here. You don't know what you're talking about. So it's so frustrating. It literally is like looking at, a color and saying, excuse me, what are we going to do with this red ball? What red ball? There's no ball, and it's whatever you're seeing there, that's blue. No, it's red, it's a ball. Just what do we do here? What are you talking about? It's blue, and I don't see a ball. It's so, I don't know why that bothers me so much, except I do know the one thing that bothers me is that these are my patients. I know how to help them, and they are dying. For years, for now 2 decades, I've said I'm like a surgeon walking around on the streets of my town, every town now, looking on the streets and saying, well, I could operate on that and fix that. I could operate on that and fix that. I could fix that. And no, it would be against the law if I went near that person. That's the situation I'm in. And it's extremely disturbing. It really is just so upsetting.
Whether Einstein really said it or not, I think it's attributed to him. The definition of insanity is thinking you will solve a problem by doing the same thing over. It keeps getting worse, and you keep doing more of that wrong solution. That's what is happening in British Columbia and across Canadian cities with these perhaps well-intentioned harm reduction programs that have been corrupted, and they're not working.
So this guy here's an overdose in your streets, and one of the other addicts prevents somebody nearby from administering Narcan.
Come on, brother. You don't even know what you're talking about.
You're not fucking doing that. Leave him alone, bro.
Calm down.
Don't give him Narcan. Don't revive him. Now, to me, that's how my patients behave. That makes perfect sense to me. To an average person looking at that, they're going, what? I don't understand. Why wouldn't they want to revive him? Because when you give them Narcan, not only do you block their high, but you throw them into withdrawal. It's very uncomfortable. And the other addicts, those were the other addicts saying, don't do that to him. Let him take his chances. When you're in addiction, you don't really care if you die. All you care about is you get the drugs. That's really all you care about. Now, when you're confronted with near-death experiences, sometimes that gets through, but not necessarily.
No, I mean, in a way, the addicts within their condition, they're acting rationally. They want their high. They got that drug for a reason. We being outside that mind frame and that sickness, see, why would you take the chance with dying? But look, this is the logic here. If you're practicing this type of no rails harm reduction, you're giving them that dice and saying, roll it. Really, I think you hit the nail on the head there.
Of course. They've also never seen recovery. It's so funny. Not everyone is a candidate for full abstinence recovery. Let's be fair. But I remember I talked to a doctor and I asked her, I go, have you ever, she called herself an addiction specialist. And I said, have you ever seen recovery from opiate addiction? It doesn't exist. There's no such thing. I had a whole staff of personnel who were recovering opiate addicts who are completely abstinent. And they would be dead had they been given any replacement therapy. They're all super clear on it. They were terrible drug addicts, and they would have died. They know it. And so, yeah, there are certain people that you have to put on something. But I would not give them heroin. I'd put them on Suboxone or some other, replacement that has shown efficacy in reducing death and reducing consequences, not more heroin. I mean, look, and I'm not against even like drinking houses and stuff. I'm not against the notion of it. Like British Columbia, I think, actually piloted this whole thing where they had houses where alcoholics can come in and drink as much as they want. And the reason it worked, those actually worked a little bit, is because they had people specialized all around the alcoholics, trained in motivational enhancement therapy to get them into recovery. And they had some pretty good results doing that. And let's be fair to the alcoholics, opiate addiction is different. They have a much bigger monkey on their back. Not that alcoholism isn't terrible, it is. But the opiates probably wouldn't work for them the same way it did for the alcoholics.
I mean, that's a good point. I remember as a young reporter speaking to a man that had become an alcoholic. He was from the indigenous community, and he said, if I didn't have this, administered glass of vodka, I'd be drinking hand sanitizer. So yeah, if there are people monitoring it, adults in the room, these programs, there's a chance they can work. But again, here's my point. In Canada, due to corruption, due to willful blindness among ideological government officials that just say, let's put out more opioids on the street and hope it works, and it's not working. So that's irresponsible.
Clearly. So what do you recommend? What can be done? What can humans that actually care about these people on the street, what can we do to help them?
Well, again, I come at this from an anti-organized crime perspective. And Canada, I know that you're looking, some guests are saying, hey, we're starting to understand the Chinese Communist Party actually wants Americans and Canadians to die. They want our healthcare dollars to fly out the window. They want more policing costs because China indeed does want to become global hegemon. So I say, let's start with the weak spots, Canada and Mexico. Yeah, we do need to be a fortress North America. America, where you live, is a law enforcement leader. Canada and Mexico have deep corruption and organized crime concerns. They've got problems with the borders. They've got problems with gangs that have state-level power, essentially bullying the population. So Canada needs to step up. You wouldn't believe it, but we don't have an anti-racketeering law. The RICO law is what allowed America to get control of the Italian mafia decades ago. Canada lacks that. So the Chinese triads, Mexican organized crime, terrorists from the Middle East are literally bullying our governments now. So look, Canada needs stronger laws. And once we have a little bit of a handle on those fentanyl super labs in cities like Vancouver, once we have a handle on our ports that are not infiltrated by state-sponsored organized crime and tycoons from Hong Kong and Beijing, then that supply, the fentanyl flooding in to Canada's west coast, that'll start to go down. And then we can start to administer smartly guide railed harm reduction with real doctors, real treatment.
Yeah, I was giving a lecture to a group of county officials. It's about a year ago, and I just said, why do you put social workers out to deal with the most seriously psychiatric ill patients in the entire community? Why would you do that? They're like, oh, we didn't know. That's just the way they do it. They told us how you do it. I go, well, then just stop it. Stop it. Social workers are great. It's literally like sending physical therapists out to do surgery. Physical therapists are wonderful. They can't do surgery. They don't know. They've not been trained in that. And social workers are not psychiatrists, and they're not internists, and they don't know how to manage these seriously medically ill patients. They don't know. They don't know the difference between somebody who's dying and somebody who's not, what the interventions ought to be. They have no idea. They have zero training. So it's just, I don't know. I've been complaining about it for so many years, Sam. I really have been complaining about it for 15 years straight.
Drew,
Well, first I was complaining about the opioid prescribing. I was complaining about my peers first because my peers were killing my patients hand over fist. And then this thing developed, and it's like, okay, now at least it's not my peers doing it anymore.
Drew, I can hear it in your voice, and I think you can hear it in my voice. I would think that Canadians and Americans, we all enjoy our sports, we enjoy our TV, but we need to get angry at our government officials that are letting this crisis, they're letting this crisis like wildfire spread across our cities, and people, our children more and more will be sucked into fentanyl. If you need to start getting righteously outraged. The average person, that's what you need to do.
But how much more, let me ask about this, which is, how can we, how many more bodies need to pile up on our streets before people go, maybe these people don't know what they're doing? You know what I mean? I mean, how much worse can it be than it already is? Why isn't there righteous indignation?
Well, that's a $1 trillion question. Look, I could go off for days on how people were told not to question the government narrative when that pandemic was rolling out. No, do not dare question whether that might have come from a lab. Everyone was a conspiracy theorist. So look, everyone that says the government doesn't know what they're doing with harm reduction, you'll be treated like a conspiracy theorist. But I think we have two individuals on this show right now that from their different areas, no, it's not being administered well by the government. So look, all I can say is to the average person, do your reading, start writing your letters to your local officials and say, hey, there's some smart people saying this is getting worse, and there's no one there's no one with the right prescription. I just gave mine. Yeah. Let's crack down on transnational organized crime, and let's do healthcare smart. Let's not just trust ideologues to give away drugs.
Exactly. I want to talk to you in a second about the election interference by the CCP in 2019 and 2021. But let me just give you my prescription that I've thought about very long and hard about in California. We need to reopen the LPS, the Lantern and Petra Short. The ability to hold people against their will needs to be reconsidered. Yes. And people's brains are not working right. Number 2, we need more psychiatric beds. Number 3, we need more psychiatrists. Number 4, we need large residential units. We can build beautiful residential units with vocational rehabilitation and all kinds of things. And 5, One Flew Over the Cuckoo's Nest was 75 years ago, and it was not a documentary. 75 years ago. That is not the way psychiatric hospitals are now. We need to attack the laws the way you said, on the side of prevention or getting at the criminality, but we also need to loosen the laws that give us the opportunity to get people off the sidewalk, to give people mandated care if they break the law, to say you can't break the law when you want to steal to support your habit. All these things have got to change. All right, tell me about election interference.
Yeah, I would agree. Let me just say, I would like to import you up to British Columbia and have you run for premier or governor. And I think we'd get a pretty good fix if you were. But look, the election interference story does connect, stunningly, to fentanyl, to money laundering. My argument, which is well-founded, is that, look, again, the Chinese Communist Party has seen Canada as a weak spot, and as we're learning, America as well. The story just broke this week that they're mailing IDs and licenses so that Chinese students could vote for a certain candidate, allegedly in the 2020 election. But they've gone beyond that, already proven in Canada. They are busing students into certain ridings with high Chinese migrant populations. And in one very well-known case, the students were told, hey, you need to nominate someone for this seat that's going to sit in Canada's parliament. If you don't, you're going to lose your right to your student visa in Canada. You could be under threat. Your family could be under threat. So here's the key theme here. International students from China under, unfortunately, Chinese Communist Party control are being leveraged against Canada's elections. And guess who the bosses are? The neighborhood thug, fentanyl money launderers, drug traffickers. They've been protected by the Chinese Communist Party for years. As long as they fulfill the objectives of interfering in Canada's elections, they're going to be assisted in doing their money laundering criminality worldwide. So look, Drew, I could speak for probably 10 hours on how infiltrated Canada's recent federal elections have been. I'll just tell you the most egregious case from the just passed federal election. A candidate from Hong Kong, he's a Christian Canadian now living in Toronto, ran for the Conservative Party. We learned during the 2025 election, he was told by our federal police, it is not safe for you to campaign in person because there are threats against you from these Communist Party networks. It was proven, the New York Times reported on this as well, that the Chinese Communist Party sent out messages through WeChat, probably TikTok, social media. People, if you're Chinese, if you're living in Canada, don't vote for this man, Joseph Tay, because he is under a national security bounty in Hong Kong. And so it's a complex story, but in a nutshell, in Canada, our elections in certain ridings are no longer free and fair. People are not free to vote for who they think is the best candidate. Some people are voting for who China is thuggishly telling them to vote for. That's the situation in Canada.
All right, we're going to take a little break and we're going to revisit this topic after the break. And I want to know how that is bleeding down to your southern compatriots down here. Sam Cooper, again, you can follow him at Scooper Cooper on X, and we'll be right back. Elex Michaelson going to join us a little bit later. See you in a minute. What's so special about Paleo Valley's grass-fed and finished bone broth and superfood bars? Well, everything. All are delicious, high in nutrients, low in calories, and contain nothing artificial. Co-founder Autumn Smith on what goes into every superfood bar.
So we have bone broth protein powder, and then we've added other superfoods, cashew butter, we have spirulina in there, acerola, broccoli powder, kale, blueberries. And so it really is kind of just an infusion of superfoods with every bite.
And then there's the extraordinary bone broth protein made with an ancestral approach that boosts our collagen intake.
Collagen is something that's gone by the wayside in our modern diet because we don't eat nose to tail anymore, but it was something we ate a lot of, and it has so many benefits. So if you have sagging skin, joint pain, gut issues, your decreased bone mineral density, slow to heal your wounds, slow recovery, these are all things that collagen can dramatically improve. If we're not giving our body the building blocks to produce it, we just age more rapidly. It also improves sleep, improves blood sugar control. So it's essentially like the Swiss Army knife of healthy aging.
Like I said, Paleo Valley's bone broth is something special. Make Paleo Valley part of your longevity regimen. Go to drdrew.com/Paleo Valley for 20% off when you subscribe and 15% off your first order. That is drdrew.com/Paleo Valley. The Wellness Company knows that taking charge of your family's healthcare is a top priority, and that's why they're constantly innovating to deliver the products and services to help you be rationally ready. Be sure to have the medical kit for kids on hand, whether you're a parent or grandparent. It treats 20 childhood conditions, including nausea and vomiting, allergies, asthma, inflammatory illnesses, even bioterror, God forbid. Listen, croup, ear infections, lice, it's all available in the pediatric emergency kit. You can also order the kids kit with an EpiPen should your child be at risk of anaphylaxis. And those EpiPens are carefully sourced and well priced relative to other EpiPens in the market. All 7 kits, each customized for a different purpose, come with a telemedicine consultation and a guidebook. Skip the scramble to an urgent care waiting room full of sick people and expense, or a pharmacy where there's no guarantee they'll have what you need. Go to drdrew.com/TWC for 10% off any medical emergency kit, or the supplements for that matter. That again is drdrew.com/TWC.
So I've traveled with my hyaluronic acid serum for my face, which I use every day. And we also brought along the active skin repair. Thank goodness, because I wounded myself. I'll show you the wound as we go. I don't want to pull the dressing up just yet. But the hypochlorous acid in this was used. I used it as an antibacterial. It's been proven as an antimicrobial. And the thing is healing beautifully, like better than ever. Like, it feels great. Here's a picture of what it looked like before I put the dressing on. I was delighted by the effects of the active skin repair. Hypochlorous acid is antimicrobial. It's been clinically proven, and this thing is healing well without difficulty. If you'd like some, go to drdrew.com/skin repair. I'm now free to enjoy my trip, not worry about infection, not worry about bleeding all over the place. This has been working beautifully, and I can get on and keep traveling.
Dr. Drew said the best way to quit drinking is by going cold turkey, and he's a doctor, so why would you question doctors?
Dr. Drew called me unfixable.
Speaking of unfixable, this homeless situation makes me feel like it is unfixable given the forces that are arrayed against it. Sam Cooper is a journalist, founder of The Bureau. Go to thebureau.news and also follow him at Scooper Cooper. Sam, how is it affecting others? And Willful Blindness is the book. And tell me this, as it pertains to the book. You frame it as willful blindness. Willful suggests that there's conscious intent. I feel like it's like brainwashed blindness. Like they're so bought into their ideology, they can't see reality.
Well, with regards to the organized crime infiltration that Kash Patel would be speaking about in Vancouver, my argument, and I believe well proven, is that, look, in government casinos, there was over $1 billion in drug cash laundered in 2014, all of it coming from travelers from China they're developing real estate in Canada. They're pouring fentanyl cash through a Canadian government casino. And so there had to be not only willful blindness, which is the legal term meaning, look, British Columbia's government was turning a blind eye because that money is going into supposedly paying for healthcare, police, etc. But of course, illogically, China is sucking out, money out of our healthcare system. Essentially, fentanyl is being laundered through our government economy by people that want to hurt ultimately North Americans. So that's the willful blindness, but there's corruption involving a form of corruption is Canadian politicians and regulators that won't change the laws, as I'm indicating. We need an anti-organized crime racketeering law. There hasn't been one in Canada. They even, Drew, you'll shake your head. They took the federal port police out of Vancouver in the 1990s, as I wrote, allowing the same Chinese military and organized crime entities that are in Panama and the west coast of Mexico to run the ports. That's the willful blindness that traces into corruption, I believe. So that's my prescription of what's wrong in Canada. Look, at the end of the day, some politicians, I think, are going to not only have to lose their jobs, we're going to need to see some politicians and lawyers go to jail.
That would make sense. How is it affecting us down here, do you think, other than everything trickling down, money, the corruption sort of moving this way?
Well, the thing is, the FBI 2 years ago said they're opening a case on China and, counterintelligence one every 12 hours. And now we're really starting to see them bubble up with the FBI. Again, I reported for the Bureau this week, Fox News was also all over it, that the FBI knew in 2020, allegedly, that China was using the TikTok app to harvest identity information on Americans, use it to create fake IDs, mail them. They actually, Customs found they mailed 20 fake IDs into Chicago so they can be distributed to Chinese international students. And, with the plan that they would vote for, I guess they like Joe Biden a little bit more than Donald Trump. And so, as you know, the story here is the FBI says, look, that report was made to go away under the former FBI director. Senator Grassley has now asked for that report in its unredacted form. And so they're looking at whether, and I do think it's plausible, Beijing did interfere in the 2020 election. As you know, the big story is about, again, Chinese students using American universities to run potential agro weapons into University of Michigan. Look, I would say that Canada has been essentially infiltrated deeply in our institutions. And we can see with what's coming out in the FBI or these cases in New York called the so-called CCP police stations, that America is just as attacked. But I'm going to say, look, the silver lining for Americans is you actually have some law enforcement entities that will and do have the tools to put people in jail. That's lacking in Canada. But I do think, look, the world is getting more dangerous, whether it's in Iran and Israel, Taiwan, China. We're getting very close to, expanding global conflicts, and we're going to see China more and more directly attacking. Their final objective is, of course, the United States, the center of the free world.
Sam, I'm going to leave it, although you tilted me towards pessimism, I'm going to leave it with the optimistic note that we have the tools and the laws in order to get the work done if we just have the will to do it. Where would you like people to go besides Scooper Scooper Cooper and the Bureau.
Well, yeah,
book,
I want
of
to
course.
support you on that. The political will is very key. So go to thebureau.news, my new website, which follows Willful Blindness as a bestseller. The Bureau now has 30,000 subscribers. I'd like to convert more of those to paying subscribers so I continue holding people to account. And I want to get like you. I want to change policy to save lives, to improve lives in North America. So come to thebureau.news. That's the main spot to find me.
All right, Sam, we appreciate you being here and thank you for your work.
Great to meet you.
You as well. All right, next up, now becoming a frequent flyer on this show, Elex_Michaelson on X. Elex Michaelson is a anchor on Fox 11, LA local news, and he has been at the forefront of so much of what's going on with the riots. We thought we'd check back in with him. Elex, we appreciate you being here. Last time we had a little bit of technical problem, and now people can actually hear you with clarity. Let me just
I don't know if that's a good thing or a bad thing. I guess it depends on your perspective.
It's a good thing. And Elex and I worked together for a year across COVID. We did a special every night on, what did we call it? I forget what the name of it was, the COVID special or something?
The Fox 11 News special report. Yeah.
Special report, call it special report. And I look to you as you work so hard at trying to get to the truth, which I appreciate with just immense gratitude. And one of the things you're working on, of course, was what was happening in our streets this weekend. Let me just start with some simple questions. We now have a curfew. Guess what? It worked. Is it working? I think. And what took them so long to get to a curfew?
Well, factually, we no longer have a curfew because the curfew went away last night. And part of the reason it went away is because it was working. So let's hope that it now things have cooled down. Yes, the curfew worked. The big problem in downtown Los Angeles, which was a pretty isolated problem to a small area, was a bunch of anarchists who come out at every single basic protest, whatever the cause, and like to cause problems, usually very late into the night, and they draw a lot of police resources. So the solution to that was to make sure that one area where they always go wasn't open to them late at night. And it seemed to work. We saw a major drop-off in violence and rioting, so much so that they lightened the curfew, and then last night just got rid of it altogether. And there were no problems last night. The first night without the curfew. So hopefully we're sort of through this period. The question is, though, the Trump administration has made pretty clear that this concept of ICE raids is not over, and that there's probably more to come and could be even more aggressive in going after blue cities like Los Angeles. If that happens and people continue to get picked up, could there be more protests and rioting in the streets? And we'll see. I mean, there's a reason why the National Guard keeps getting put in. Yesterday, they called for 2,000 additional members of the National Guard to make it about 6,000 troops in the streets, plus 700 Marines. So the point of that is not just to protect the buildings. The point of that is to go out with ICE agents and protect them as they try to apprehend people.
And we hear also, though, Trump saying he's going to soften his position on the hotel workers, essentially, and the agricultural workers. Is that going to make any difference? It seems like Home Depot has become sort of the ground zero.
He said that. So he said that last week. And then early this week, he reversed that and said that actually isn't the guidance. And Homeland Security sent out to ICE agents saying, go forward with the farm workers and with the folks in the hotels and all the rest of that. I mean, there is some credible reporting that Stephen Miller, who is the head of this whole policy for the Trump administration, believes that everybody who is here illegally should be kicked out. And he's looking for 3,000 people a day to be apprehended. It's a lot easier than getting criminals and doing all this sort of research and finding people. Going to Home Depot. It's a lot easier to find people who are here illegally there, or car washes, or go out to farms where farm workers are. And so that is good if you're trying to sort of stat pad the idea of getting a lot of illegal immigrants out quickly. That is bad if you're concerned with the economy of Southern California, which is based off of a lot of immigrant workers.
I'm a little confused by the farm worker thing. I thought we had an agreement with Mexico that allows large numbers of farm workers to come up, work through the season, the harvesting season, and go back. Is that being overrun by illegal immigrants? Is that
part of the problem? Part of the issue, if you believe it, is that a lot of the people that apparently are being sort of swept up almost indiscriminately and put into these detention facilities have legitimate excuses. I mean, we talked to Democratic members of Congress yesterday who said they went into a ICE detention facility in Adelanto and they met dreamers, they met asylum seekers, they met people who supposedly were going through legal processes and then got caught up anyways. Maybe they'll be able to plead their case and get it all figured out, or maybe not. Another place that we've seen been targeted, which I think is
we'll see if that comes.
Hearings that they're.
Caleb, we lost a little bit of that. You said you were talking about the hearings they wanted to have.
Yeah. People show up to courthouses, and the government says show up at this date, for your check-in as you sort of work through the process. And as they show up, what the government told them to do, they're being apprehended. And so that is creating a reverse incentive structure for a lot of people. When why would they then show up when the government tells them to?
Of course. And to that point, some of these things I have big question marks over my head, and that goes right at one of them for me, which is everybody seems to agree that the naturalization process is overly cumbersome and bureaucratic and expensive, and I've never heard anybody disagree with that. Why can't we get that adjusted so that some of these people are getting caught that are legitimately in the process?
Well, we haven't had real immigration reform since 1986, almost 40 years ago. So we're still dealing with that system. We haven't even modernized that. Yeah. Why? Because the bases of both parties are so ideological on this, they don't see any reason to compromise. On the far left, there are people that believe in open borders, that ICE should be abolished, and that there shouldn't be police. On the far right are people who believe that there shouldn't be any people here illegally, period. So deport 11 million people.
And then there's the rest of us.
Right.
And then there's the rest of us, which is the whole of America, essentially.
So those people, but here's the problem. There's two different things happening. One, that base, they vote in primaries. And so people are afraid of getting primaried by that base. And two, you know what donors want? And for both parties, Republican and Democratic donors?
What do they want?
Cheap labor. So they like the system, because if you get rid of this system, they have to pay more. So the rich folks who write the biggest checks to both the Democrats and the Republicans have an incentive to keep this system in place. So that in politics is what you call, an incentive structure. The people that pay you the most money and the people that could vote you out of a primary. And that's why there's been no action.
I have two other topics I want to quickly brush past you. One is former Governor Schwarzenegger. I know you know him and have sat down with him. Were you surprised at him, at the view saying people need to go through the process, and then once they're here, they need to serve the country?
I'm not. I was actually with him a couple of weeks ago in Austria. I went to his global climate conference. He asked me to speak, and
Fantastic.
we shot an entire half-hour special. We shot a half-hour special that's airing this week on The Issue Is, our statewide show. So I encourage people to check it out. And I had a chance to talk to him on camera and a lot of chance to talk to him off camera. So I wasn't surprised. I mean, people forget Arnold Schwarzenegger is a Republican, right? He disagrees with a lot of things that President Trump believes, but there are Republican values in him. And one of those is this belief that we should incentivize people to do things legally, including immigration, and that we should reward people that do things the right way. And as you know, Dr. Drew, a lot of people that did immigrate legally, including a lot of Latinos that immigrated legally, are the most anti-illegal immigration because they did go through the process, and they're the most offended when people try to cut the line. So Arnold is, speaking for a lot of people too. I mean, I know that there are a lot of our viewers that are horrified by the images of what we've seen in terms of ICE, especially in a city like Los Angeles, which is 50% Latino. But I also know that there's a lot of our viewers that think it's about time. that are frustrated with what's happened with illegal immigration and think that if you came here illegally, this is the risk that you run. And you should have thought of that before you came here and broke our laws. So I know that this is a Rorschach's test issue for a lot of people, but it is a voting issue. It is an issue that drives people's participation in the political system. It has been for a very long time. And I think what's happening right now will make it even more so that way.
Yeah. I don't know where your ancestors came from or how soon recently they've come over, but mine were from the Ukraine, running away from the Holodomor, part of the Jewish diaspora.
Sure.
From that reason, as the Soviets and the Bolsheviks and the Mensheviks and the pogroms, all the stuff that we all had to run away from. There's a little bit
Russia,
of
Romania, same era, same era,
same
came
stuff.
through Ellis Island and Brooklyn and the whole thing. Yeah.
Yeah, mine had to go through Canada and find sponsors and then prove they could make a living, and then came to Hartford and then Chicago. It just one thing after, and a child dies along the way. I mean, a huge sacrifice to get into this country. You grow up with those stories, and then you see people cutting the line. It does make you go, ugh. And come on now, it is, and then you see the NGOs pushing them through. And then you see the ICE raids, and you don't feel good about that either. So it makes for a very strange kind of soup.
Well, and it is a reminder that what we really do need in this country is comprehensive immigration reform. Part of the problem, part of the reason that so many people do cut the line is because they are desperate and because there's not a good, easy way to get into this country. And so I understand the struggle that people have, especially living in really poor countries that want to have an opportunity for their family. I mean, you understand that. Not everybody's coming here to be a rapist or a child molester. No. They're coming here, a lot of them, because they want to work and because they want to provide a better life for their families. But if there should be a system that makes sense. I mean, part of it that they were working on with that bill with Joe Biden that didn't pass is more asylum courts, more immigration judges, so that right now somebody comes here, they apply for asylum, they're given a court date 3 years down the road. They should be given a court date a few days down the road. And then if they're granted asylum, great. If not, send them back right there. Don't let them into the country where they established a life and then they never show up for their court date. I mean, we see that over and over again. Our system should make sense. And it should also be geared towards what jobs do we need here in the country. That's high-end jobs. Like, why are we kicking out people at the top universities who could be our best scientists and thinkers? That doesn't make sense. But also low-end jobs. There's not a lot of Americans who are signing up to pick grapes. We need people to do that work. That's dependent on our whole food system. And so if we need those jobs, we should have a system that incentivizes people to do the jobs that we need. That's helping us. I mean, the reason a lot of people are against it is this feeling that a bunch of people are going to come here and take welfare, and the rest of us are going to have to pay for these people, and they're not going to pay anything. We should think of it in terms of how can we do this where it actually helps us? And that should be driving the system.
Yeah. Yes, it's complicated. I used to work at a county hospital back during the El Salvadorian Civil War, and people forget about the 80s. There was a huge influx of asylum seekers from a horrible situation in El Salvador. And they actually bankrupted the county systems because the state refused to pay for it. And if you remember when the county went through its crisis in LA, that it will result in a bankruptcy. It just will. We can't afford all this stuff, and we've seen it all over
Europe. We've seen it all over Europe too. A lot of these very progressive countries have been overrun by migrants, and it's changed their politics, where people rebel and go in the other direction because they can't afford it, and then they're frustrated by it. I mean, look at what we've done in California. Governor Newsom wanted to make healthcare free for undocumented folks with low incomes.
That's right.
And then the program went $7 billion over budget at a time when we're in a huge deficit. So like that,
how could it be otherwise?
How
could it be otherwise? That's how it works. But speaking of Newsom, I know you know him rather well as well. I cannot get my head around Newsom and homelessness. So we just had Sam Cooper here who was reporting about the beachhead in British Columbia and how the fentanyl is getting in and what it's doing to the destruction of their policies there. And Newsom's policies have been an abject failure. And you I don't know if you've seen him with Adam Carolla. His original encounter with him was about 6 years ago, where he kept insisting that the face of homelessness is the mother of two who has a minimum wage job, and that's everybody on the streets. That's nobody on the streets. Find me one of those on the street. You'll find none of them. And he continues to have these.
But that's not the overwhelming face. I mean, there's plenty of people on the street. There's plenty of people. There's plenty of LAUSD students who are homeless, right? And who maybe are living in hotels and all the rest of that.
Yes, there are people. Yes, there are people who are couch surfing. That's a whole different category. Yeah. There are a lot of people who couch surf and who even sleep in their cars. But they don't decide to lie down on the sidewalk. Chronic homelessness is what we're talking about. Don't gaslight us. These are sick people that need care, and we're not giving them the care. What is he? How does he live? How does he go to bed at night? That's what bothers me. I have trouble sleeping over it.
Yeah, I mean, look, I think he puts a lot of the blame on the counties, and he says, I'm giving you all this money, I'm giving you all these opportunities, this should be on you, just like he's now putting a lot of blame for what's happening in the streets of LA on Donald Trump. I mean, he's not the first politician to try to share blame to somebody else, but he seems to do it quite a bit. And he would point out that the state traditionally hadn't really been involved in these homelessness issues, that he's one of the first governors that's really attacked it. But if you looked at the results, we've spent, more than $24 billion on it, and the problem has gotten worse or gotten marginally better. I mean, there's no real results to look at. He's trying some things that could be interesting, including care court, which is the idea that people, should be able to be forced into treatment. That's, I think, something you probably would agree with.
That was a good move. That was a good move.
There's been some questions about the implementation.
Treatment is not a good way to think about it, but treatment is an option for their what do you call it, jailing, and those people do well. They conservatorships also
conservatorship reform. I mean, he's worked on that, but I think a lot of critics would say that those are both have been kind of slower than necessary, and a lot of folks at the cities and counties have said that they just don't have enough funds to deal with it. Although I'm sure you would point out, it's not really just a money problem. It's a problem about dealing with some of these addiction and mental health issues in a way that is more effective than what we're doing right now. And small. I mean, like Mayor.
Two big gaps. The two big gaps are housing first. It doesn't do anything. Housing first accomplishes nothing. And then having social workers who are not trained to treat the most seriously psychiatric ill. You can't get sicker than addiction that puts you on the street. The next stage is death. That's it. That's as sick as you can get. It's a drug addiction that drives you to the street. And social workers are not trained to take care of that at all. They don't even know what they're looking at. And so it's just, these are extremely flawed concepts. And they are ideologically driven, and they're going to kill people.
And not only is it social workers that end up dealing with a lot of these people, but honestly, it's police officers and LA County sheriffs, right? Other folks who are not the fire department, who are not really trained in addiction medicine the way that you are, but then end up having to do the job of 6 other people,
They know what they're seeing, though. They will tell you what it is. They call it like they see it, and they know what it is. Social workers don't even know what it is. They'll say, "Oh no." I could tell you stories. Anyway, I don't want to get too deep in it. It makes me so frustrated. But what else is coming up in the issue is before I let you go? What's on your mind? What are you working on? Tell us what's up for you now.
So this week, we are airing that special with Arnold Schwarzenegger. It was really cool. We went to Austria with him for a week. Not only do we have this global climate conference, but he travels to his hometown with 150 of his biggest fans for a special workout in front of his childhood home. It's called the Pump Club, and it's all geared towards getting people physically fit and also mentally fit. He has this free daily newsletter. You probably would like it, where he talks about workout and also some mental health tips every day, and has more than 1 million subscribers around the world. And it's all, he says it's the positive corner of the internet. It's only positive news, how to help lift each other up, which is pretty cool. And then we went to the oldest cathedral in Vienna. We went on a boat ride. We talked about his son, Patrick, who's this big star in the White Lotus right now and is having a moment and sort of comparing their careers. And so it's a really special, cool half hour. It was one of my favorite shows we've done. And we hope to air it this Friday. There's a picture of us together. We hope to air it this Friday. We couldn't air it last Friday because there was so much chaos. We ended up interviewing Governor Newsom and doing that whole thing instead. So hopefully things are relatively quiet and we can air it this week.
We're going to pump you up. People forget about that. The Hans
pump up
and
for the
Franz
planet is what he says at this point. Yeah.
That's so funny. Lily's grow. So exciting. Good for you. All right. Well, listen, great to talk to you, and thanks you for the update. And hopefully our fair town will stay quiet. And like you said, until there's more ICE raids, and I guess there might be more disruption. Oh, one last thing I was going to tell you about on the streets. You mentioned the Antifa and the sociopath and the people, the troublemakers. What'd you call them? You got a name for them, but rioters,
assholes.
They live, but they live on the streets too. When you go out and if you walk amongst homelessness in particularly down around Skid Row, you'll find the tents with a bunch of slogans on it. Those are those guys. They are 35-year-old to 40-year-old males with a skateboard and a backpack. That's what that's their uniform. And they are all extremely problematic people. And
and a lot of people blame the Democrats. Look, I don't think these people are voting for Trump, but I don't think they voted for Harris either. I don't know if they're voting. These are anarchist types. They're anti-police. Right. They're anti-ICE. They're anti-capitalism. They're anti-hygiene in some situations.
That's right. That's exactly right.
They're certainly not fans of me and probably not fans of you. So, I mean, there's some scary folks.
I've been attacked by them just walking through trying to help homeless people. And what troubles me is that the city council and the county board of supervisors listen to those assholes because they show up at the meetings and raise hell, and they don't understand that's who they're listening to. That's when they need to stop listening to and start kicking them out.
And start arresting them when they do some of this stuff.
Yes. Susan.
It's Susan. Hi, Alex. Is that why you always see the guy with the skateboard?
Yeah, I told him. Yeah. That's the guy. The skateboard and the backpack. That's the uniform.
Yeah, they're always breaking windows. Also, aren't you on TMZ now?
Oh.
Well, not every day, but I have been filling in a lot, and I'm filling in this week. So I'm on TMZ Live with Harvey today, tomorrow, Friday, Monday. So in LA, that airs at 4:00 on Fox 11, and it airs at different times around the country. So yeah, check that out. It's a lot of fun.
You filling in for Charles?
I fill in for Charles this week, and last week I was filling in for Harvey.
Oh, wow, how fun. Good for you. Well, I'm happy to help out on that anytime you need, I hope. I'm a little busy lately, but that's a lot of fun. That's a good show. They do a nice job. And people tend to think, light of TMZ. Harvey is all about getting at the truth. He really is a stickler about it.
He's a great journalist and one of the smartest people I've ever met.
Yep.
I don't know if I believe that there's a fourth plane, though. I saw that.
Oh, Harvey wants to make the case for a fourth plane. Well, I'm not sure he's sometimes he just raises issues to be a shitstorm stirrer. But all right, my friend, thank you so much for being here. We appreciate it as always, and we'll talk soon.
Thanks, Dr. Drew.
Audio this
Great to see you. It worked. It worked. Great to see you, Susan. Thank you, everybody.
All right. See you, man. Take care.
All
right. Coming up tomorrow, I want to tell you about, I got to get the pronunciation correct. Hold on, everybody. I'm going to make sure I actually.
So happy.
I know. Oh, shoot. I thought all right. Because they gave me the pronunciation of V. Hold on. I'm going to look at it here real quick.
I think it's Dr. Vivek Manashe, if I remember from last time, but I probably butchered it as well.
Vivek Manika, Manika, I think it is. Hang on, but Emily sent me here it is. I hear it. Viveka Manika. That's how you say it. Viveka Manika. All this time I've been mispronouncing it. And then Jeffrey Tucker from Brownstone Institute. He's been just on fire lately, and we need to get an update from him. You will enjoy that. Amanda Head on the 24th, Joe Allen on the 25th. Professor Sam Vaknin on the 26th. He is the professor that, oh my gosh, my brain. that, our friend,
That's an early one.
hold on a second. I'm going to tell you who
Pacific.
my friend. Yeah, it's going to be early in the day. Michael Schellenberger interviewed, and he has a very interesting construct about the personality styles of humanity and what we are into right now and why things don't make he helps make sense of things that don't make sense. So we'll get to him. That's 10 a.m. Pacific time, 1 a.m. Is that right?
1
I thought
p.m. 10 a.m. It's on the 26th.
I thought
It's
we were
10
going to
a.m.
be.
Pacific.
I thought it was noon and 3. We had it on our calendar as noon and 3. So that's actually 10 and 1 works great for us. So let me look at my calendar here. That's tomorrow. Yeah, 10 a.m.
Tomorrow's show is at 12 p.m. Pacific.
Oh, I'm sorry.
Yeah,
the
I was talking about
professor is 10 a.m. Oh, I beg your pardon. I was looking at the wrong thing. Okay. All right, good. Tomorrow's at noon.
26th of June.
Tomorrow's at noon and 3. Noon Eastern, 3 Pacific.
But check your calendar.
Yeah. And I'm going to do Gutfeld tomorrow night to get...
no, the other way around. Just FYI, it's noon Pacific, 3 Eastern.
Okay, if I said it the other way. Yeah. But it's noon and 3. Noon and 3, either way. And then 2 Central. And then I'll be on Gutfeld to celebrate Kat's return to the show. So until then, we'll see you tomorrow at noon East Pacific, 3 Eastern. See you then.
Yeah.
Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.